Rosie Jenkins is a 25-year-old Gravida 2 parity, 1001 at 39 5/7 weeks, who presents to the labor and delivery unit reporting regular contractions. Current pregnancy, no complications. Regular prenatal care beginning in first trimester. Past pregnancy, full-term vaginal delivery following spontaneous labor. History of present illness. Denies bleeding, rupture of membranes. Fetal movement is good. Patient having regular contractions every 4 to 5 minutes for the past 5 hours, with contractions getting stronger. Past medical history, substance use disorder, history of multiple fractures, history of sexual abuse as a child by family friend, history of tobacco use. Past allergies, none. Medicines, prenatal vitamins, methadone 30 milligrams PO every day for the past year to manage pain and get through each day, and nicotine patches. Mrs. Jenkins is now in the triage room, waiting to see the certified nurse midwife. The nurse has already introduced himself to Mrs. Jenkins and assessed her. Triage.
Hi, Miss Jenkins. My name is Garrett. I'm going to be your nurse today. Is it okay if I call you Rosie?
Yeah, that's fine.
How are you feeling right now?
I feel okay. I'm nervous. I'm excited, but I'm in a lot of pain. And can I stay here? I'm afraid.
Yeah, that's completely understandable. Lots of patients are worried about going home when they're in labor. I'm going to go get the midwife, and she's going to do some checks for you. She's going to use the speculum at first, which is what you might have seen in your GYN office, and that's to make sure that you haven't broken your water. And then the next test she'll do, she'll use her fingers to check and see how dilated you are. Do you have any questions about either of those exams?
No.
Okay. Do you have any concerns at all about being here today?
No, I just feel like the pain is, it's already, I'm afraid. I just need some help.
Okay, we have lots of things we can do for pain for people that are in labor. Some people can get medications in their IVs, and I see that you already have one over there. We also have a nurse anesthetist on staff that can put an epidural in your back, which will make you go numb between or below your belly, and then you won't feel your contractions as much. We also have other things we can do, like help you with breathing techniques as you get more uncomfortable too.
That epidural, it really scares me, but I just know that the pain's gonna get worse. I just think I need some help.
It's normal to feel a bit nervous about this. Lots of people have these feelings as well too. What I can do is go get the midwife and we can get you checked and kind of make a plan of care for you that makes you feel better.
Okay, thanks.
Okay, I'll be right back, all right?
Okay, thanks.
So Rosie, yesterday when they checked you at your prenatal visit in the office, I know that they said your cervix was closed. Mm-hmm. Well, now your cervix is almost 2 centimeters. So that tells us that you might be in early labor. And what that really means for us is 2 options. Okay, so the first is you can go home and you can be there, you can eat and drink, you can walk around, or you can stay here and we can have you just walk around here for a while and see if your cervix changes at all.
I don't want to go home. I can't go home. I
Too
can't.
much?
Mm-hmm.
Okay.
Can I just walk around here?
Absolutely. Let's go ahead and get these monitors off you since your baby looks like it's really doing great, and we'll let you walk around for a while.
Okay, thanks.
Okay.
So Rosie, how was that walk?
Felt good to stretch and walk around, but now I'm so tired.
That's perfect time to get back into bed. We need to go and listen to the baby again.
I don't have to be on that thing the whole time, do I? I really don't want to, and I think I specified in my birth plan, right, that I don't need to do that.
Right, you're absolutely right. That was definitely in her birth plan. One of her preferences was not to be on continuous monitoring. Is that possible?
Yeah, definitely. We have an intermittent monitoring policy here. So what that means is we're just going to put you on the monitor for a couple of minutes every hour, and if the baby looks great, we can take it back off again, and you can be free to walk around or do whatever positions you like. However, if we have to give you the pain medicine, we're going to have to put you on the monitor continuously just so we can see if there's any changes in the baby's heart rate. And it's safer for you and for baby that way. Does that make sense?
Yeah, that would be great.
Perfect.
Yeah. And there was that ball that we talked about, remember?
Yeah, the birth ball. I think
Okay.
you're really going to like that one.
Okay. And you were talking about the epidural. It still really scares me.
Yeah.
And the pain's just getting really bad now, but oh crap, did somebody get my methadone? I've been on I've been so clean for so long, and I've been really good, and I know I need to keep up with it. Did someone bring it up from the pharmacy?
I need to go check and see if it's ordered, so I can run over and do that. I'm also going to call anesthesia and let them know if they haven't been by yet that they need to come talk to you about getting that epidural so we can get you feeling more comfortable.
Okay, thank you.
You're welcome.
Team Huddle.
Hey Erin, Miss Jenkins has just been admitted. I'm doing a non-stress test on her, and if it's reactive, she wanted to have intermittent monitoring. She knows if she's going to get anything for pain that she's going to have to be switched to more continuous form.
Okay, if you want to do intermittent monitoring, I'm happy to write the order for you. But Garrett, as you know, you're going to have to be going back and forth in there every few minutes. How's your staffing ratio today?
Our staffing is pretty good. I'm going to be one-to-one with her because of her history of substance use disorder. She didn't really tell me any reasons why right now she wanted to have intermittent monitoring, but I'm letting her lead the way based on her birth plan.
Okay, fair enough. What about pain meds? I see she's on 30 milligrams of methadone. What's her plan for coping?
Yeah, so I met with her in one of her prenatal visits at the clinic, and we talked about that, and she's fearful of needles, but she's more fearful of exposure, accidental exposure to narcotics. So when it's time and she's ready for her labor epidural, I can put together a solution that's of higher concentration of local and eliminate the narcotics out of the infusion. Sound like a plan?
Perfect.
Hi, excuse me. Hi, Garrett. May I speak with you for a moment?
Yeah, sure.
Mrs. Jenkins and I just realized that she's out of nicotine patches. Is it possible we can get some ordered from the pharmacy?
Hey, that's a great catch. Thanks for monitoring that. We'll add that to the list. Nicotine withdrawal during labor and delivery is something we definitely want to avoid for her and the baby.
Great, thank you guys so much.
Okay, so now she's telling us what to order?
I know it can be frustrating incorporating new members of the team, but honestly, in my experience, doulas can really calm the patient down and improve patient outcomes. Her suggestion was a good one and puts the patient at the center here.
You're absolutely right, Bruce. I apologize. Okay, the order's in.
Great.
Delivery.
All right, Rosie, you got this. We're almost
How much
there.
longer? I can't
Almost
do
there.
it anymore.
Okay, Rosie, you're doing so great. You're doing so great. Your baby's head's about to come out. One more great big push. You can do it. Keep going, keep going, keep going. Push, 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 push.
You got this, Rosie.
Okay, and stop. Stop pushing, Rosie.
Hold on for a
Garrett, we
second.
have a shoulder dystocia. Can you please start the clock?
All right, starting
What
the
does that
clock,
mean?
dropping out of the
What does that
bed.
mean? What's
Can
happening?
you please press the emergency
What's
button?
happening?
What's
What's
happening?
happening?
Nurse anesthetist in the attending position.
Got it.
Rosie,
Calling right now.
Rosie,
What's happening?
listen real closely. Listen. Okay, so your baby's head is out, but the shoulders aren't coming like we like it to. Okay, so we're gonna get some extra people in here to help us out with that. It's an emergency situation, so what I need from you right now is to listen really, really carefully, and you're gonna help us to help your baby come out. So that means I'm gonna have to do some maneuvers. Do I have your permission
Do whatever you need
that?
to do. Do it.
Okay, great. We're gonna do Roberts and suprapubic, please.
McRoberts, which side is the back on?
Back is maternal, right? So you're good.
What's happening? What do we do? What do we do?
Okay. Deep breath in, Rosie, and push. Hard as you can. Good. Okay, Rosie, stop pushing.
Ms. Jenkins? Hi, I'm Dr.
We're at 30
Tiffany. I'm
seconds.
part of the care team. Okay, as I get ready and everything, I'm going to ask him a few questions while we get set up, okay? Erin, team, where are we?
We did McRoberts and suprapubic unsuccessful. I'm about to try posterior arm.
Okay. Do you need me to step in or are you okay?
No, let me try this first.
Okay.
No, okay, Rosie, and
Doing
push.
great, Rosie.
Push. Good job.
Almost there, Rosie.
And you have a baby.
Anesthesia. Hi,
Good job, Rosie.
We didn't.
Everything's going
Good.
right
Just
now.
take a deep breath.
Good job, Rosie.
Great job.
Congratulations.
Where's my baby?
You're on the warmer right now.
All right, good
What's the
job.
time, Garrett?
She looks
About
good.
45 seconds.
And you did a great job, Rosie.
Have we got 1 minute after our score?
Okay. Coming up. 1 minute after our score is going to be 9 for accurate cyanosis.
We'll talk about it in a little bit, okay? We're going to get this placenta out.
Great. She looks fantastic.
Her oxygen levels are great.
Placenta's out, Rosie.
Great. She's
Aw.
breathing really good.
You did excellent. You did great. Sounds like baby's crying over there. Okay. We're going to talk about what happened in just a moment, but first I'm going to take a look to see if you have any tears. Okay, and if you need any stitches. Okay.
It looks like we have a 3rd degree.
Okay.
Just confirm that for me.
Yes, absolutely looks like a 3rd degree.
Okay, great. I'm not necessarily comfortable with my skill set doing a 3rd degree. Would you mind doing this
Oh,
up there?
absolutely.
Excellent.
You just get set up here.
Let me step aside. 3rd degree.
It's just a little tear. She's going to explain what's going to happen next, okay? And then your baby's over there in the incubator.
Which sutures do you want,
How's your
doctor?
pain level?
Which sutures?
Oh, may I get a 2 of Vicryl on a CT, and then we'll also get a 3O on an FH.
Sounds great.
Put some more medication through your epidural catheter, okay? But as we talked about, I won't use any narcotics, okay? So I'm going to numb you up just a little bit more, okay?
Anything set up?
Yeah. Quick look at this baby. Okay, I'm going to bring her over in just a sec.
Can you see her?
She looks fantastic.
Great. She looks
She's
great.
Beautiful.
She's got a great cry. Listen to that cry.
What are you going to name her?
Her name's Jamie.
I love it. Beautiful.
So Rosie, I put some medication through that epidural catheter. There are things feeling a little more numb down there?
Yeah, they are a little bit more much
Okay,
better.
great.
Thank you.
Oh, you're welcome.
Thank you.
Absolutely.
They're going to bring her over in just a few minutes, okay?
Yeah, and they're going to bring her over in just a second. How do her arms look?
Really good. We just did a quick assessment and
Looks like she's got full range of motion.
absolutely.
Excellent.
Sometimes we worry about that when babies have a tough time coming out, but she did just fine.
Absolutely beautiful.
Great job.
So Rosie, what happened is really considered an obstetric emergency. It's called a shoulder dystocia. And if anyone ever asks you in the future if you had any complications with your delivery, if you have another baby, you want to tell them you had a shoulder dystocia.
She's beautiful. Now you did have what's called a 3rd degree laceration. There's a bunch of stitches that we placed there, so you may feel some pain and discomfort for about 2 weeks after as the stitches dissolve. We'll have you come back to labor and delivery so we can do a quick check. You can come right here to triage on labor and delivery. Okay?
And Rosie, because of the medication I put through your epidural, your legs are going to be numb and they're going to be weak for a couple hours, okay? So, but after it starts to wear off and you start get feeling back in your legs, it'll be time to get out of bed and you can start walking around. But don't be surprised if your legs feel a little weak and numb for a couple hours.
Okay, thanks everybody. Is she going to be able to breastfeed after all of this? I feel like she's gone through so much.
We're definitely going to get started on that just as soon as we get you all set up here, okay?
Congratulations, Rosie.
Congratulations.
Happy birthday, Jeannie.
Breastfeeding.
Oh, look, I think I remember from my breastfeeding class, it looks like she's hungry. Can you help me get set up how I was before with the pillows behind my back?
So I actually have to be honest with you. I haven't actually had a woman who had a substance use disorder that wanted to breastfeed. So I'm actually going to call my colleague so that she can help me out. Is that all right?
Yeah, fine. I mean, I didn't actually know I could either until my last baby, so just call whoever you have to.
Absolutely. I'll be right back. Hey, Beth, are you charged tonight?
All night. What's up?
Oh, great. Can you call lactation for me for Miss Jenkins?
There she is. Hey. Oh, sorry. Are you, you're on tonight, right? Okay. Could you come up and see Miss Jenkins? She experiences substance use disorder, and we'd like to make sure she gets off on the right foot with her kiddo. Yeah, she's in room 4. Awesome. See you in a bit.
Thank you so much.
You're welcome.
Hey, so it looks like she was ready. You were right.
Yeah, oh, that's actually, I can't really hear you. Can you hear me?
Let me get that for you.
I tried, I thought it would just like calm us down and have a nice environment.
You have all the right instincts, honestly, because what we want to do, especially with babies that might show some signs of withdrawal, is that we want to have a quiet environment and keep her nice and calm. So you're in the right place.
Thanks. Yeah, I want to try and latch her on again. I just feel like I'm not getting it quite.
Lactation is actually on her way, so she's going to help us out as well. But I think she's got a pretty good latch.
Okay, great.
What I will say too is something that they let us know about was that if you might want to do some skin to skin with her, that'll also help to calm her down.
Yeah, last time it was so cute. Her arm was like next to my arm.
Yeah, we'll definitely try to get her into a good position for you. Oh, it's great. It's going to be lactation.
Oh, good.
Oh, hi Joanne, how are you?
Fiona?
Yes.
Ms. Jenkins?
Hi.
I'm Joanne, I'm the lactation consultant. How are things going?
Going okay. I'd love for you to take a look. I'm not sure if she's latching okay.
Okay. And this is your second child?
Mhm.
You breastfed your first, or?
I didn't breastfeed my first. It was so confusing. I didn't know if I could or I couldn't, and so I just didn't. But anyway, I really want to now.
Oh, okay. Well, lots of times moms who are breastfeeding for the first time have questions about latch. So looking at the baby is positioned nicely, facing you belly to belly. Has some room at the neck here, so because you don't want their chin down at their chest, they can't really open their mouth wide. And then look, the jaw is moving with sucking, and the lips are nice and flanged, and baby's looking very happy.
Okay.
So this looks good as far as the latch.
Oh, good.